Hello, my name's Emma Turner. I'm a nursing and midwifery lecturer at Uni SQ and also have a special interest in diabetes, particularly type 1 diabetes. First of all, I'd like to start with an acknowledgement of country. Uni SQ acknowledges the First Nations of Southern Queensland and their ongoing connection to country, lands and waterways. We pay deep respect to elders past and present. As I said, my name's Emma Turner. I've been nursing for over 20 years now, probably well over 20 years. My interest in type 1 diabetes really started when my son Fred was diagnosed in 2015, just a couple of weeks before his 8th birthday. Since then, I have been involved in advocacy, fundraising, raising awareness, etc., both out in the southwest or central west rather, and in Darling Downs and Toowoomba. And Fred has now finished school. He has done his own little talk. So if you've got time, I think it's only about 4 minutes, and you can hear his insights into actually living with type 1. But first, I just thought I'd start with an introduction to diabetes. And I'll just preface it with saying that there are other variants of diabetes, but for today, just for time's sake, I'm only going to talk about the three main ones: type 1, type 2, and gestational diabetes. So diabetes mellitus is a chronic metabolic condition characterized by high blood glucose or high blood sugar levels due to inadequate insulin production, ineffective use of insulin, or both. Insulin is a hormone which is produced by the pancreas that enables glucose to enter cells for energy. When this process is disrupted, glucose builds up in the bloodstream, leading to various health issues. As I said, I'm just going to focus on the three main types today. So type 1 diabetes, and you'll see in this picture, that's a continuous glucose monitor inserted into the skin. We're actually on Dexcom 6 now, with the 7 just being introduced into Australia. So this is a slightly older photo and they're a bit smaller now. Type 1 diabetes is an autoimmune condition where the immune system attacks insulin-producing beta cells in the pancreas. It's typically diagnosed in children and young adults. Well, previously was typically diagnosed. Now more and more young and older adults are being diagnosed. As to why, we're not quite sure as yet. Once diagnosed, patients require lifelong insulin therapy for their glucose management. And I will discuss a bit later on about how they can get this insulin in, but unfortunately, at this stage, it requires injections subcutaneously, so just under the skin. Also, a lot of people, type 1 diabetes, and it will be on the next slide, but because the symptoms can be quite generic, it can take a while to be diagnosed. So a lot of people are actually diagnosed in diabetic ketoacidosis or DKA, and this can make them particularly unwell. This is the most important thing to remember. If I can look back on prior to when Fred was diagnosed, my 3 boys had all just started at school. Well, the youngest had started at school. I was exhausted. I was studying medicine overnight and just did not pick up on these signs. I took him to the hospital and I took him to the doctor, but it just wasn't picked up until he was quite unwell. But if you just remember the 4 T's: toilet, thirsty, tired, and thinner. So if somebody, you notice they're going to the toilet more often to wee, they're really thirsty, can't stop drinking, they're tired and they're losing weight, please take them to a doctor or somebody to do a finger prick just to check. If you can do that, it will stop any other issues. Well, it won't stop them, but they'll be picked up earlier, which makes things much, much easier in the long term. Type 2 diabetes is the most common form of diabetes. it's said it can be up to 90 to 95% of all cases of diabetes. It involves insulin resistance, where the body's cells don't respond effectively to insulin. It's often coupled with reduced insulin production over time. It's strongly associated with obesity and a sedentary lifestyle and genetic predisposition. But having said that, it's not always lifestyle issues. Can often be managed with lifestyle changes and oral medications, but eventually some people will require insulin. So you'll see in this picture there's a pricking device here in the corner. And this is what a reader or a blood glucometer, where you can actually check the blood glucose levels, and strips used for that. And this is an insulin needle. Gestational diabetes, or GDM, is a form of diabetes that only occurs during pregnancy and usually resolves after childbirth. It's caused by hormonal changes that affect insulin action and increase blood glucose levels. Every woman should be offered at least screening between 24 to 28 weeks of pregnancy. And that requires a glucose tolerance test, which is not a pleasant couple of hours out of your life. You have to you have to have a blood test and then drink an awful drink and wait an hour and drink some more and wait another hour. But well worth it in the long run. Women who are diagnosed with gestational diabetes are at a higher risk of developing type 2 diabetes later in life. Oh, sorry. The prevalence of diabetes in Australia, according to the Australian Institute of Health and Welfare, as of 2021, approximately 1.3 million Australians live with diabetes. And as I said previously, type 2 is the most prevalent. The incidence of type 1 is increasing, particularly among children and adolescents. And as yet, we're not entirely sure why. Gestational diabetes affects around 5 to 10% of pregnancies in Australia, with rising incidence linked to increased maternal age and obesity. Diabetes poses a significant public health challenge, contributing to complications such as cardiovascular disease, kidney failure, and lower limb amputation. The current Australian guidelines, we've got a few different places that are best to look up for any information. Diabetes Australia is super important, with the National Diabetes Subsidy Scheme runs underneath Diabetes Australia. And that's where you can get your subsidised diabetes medication, not medications, paraphernalia, etc. There's the Australian Diabetes Society, Diabetes Feet Australia. I've got all these links at the end of my talk too. The Australian Government Department of Health and Aged Care, Australian Diabetes Educators Association. So that's more for health professionals, but you can still get some good information from there. And likewise, the Royal Australian College of General Practitioners, and JDRF, which used to be known as Juvenile Diabetes Research Foundation. And that they're changing their name. America and Europe have already changed to Breakthrough T1D, just because, as I said previously, we've recognised that it's not just children who get type 1 diabetes, so to make it more inclusive. Type 1 diabetes management, or T1D, we generally break it down to these days. As I said, you need to have insulin. There's different ways of being able to get it, and there's also different types of insulin. So depending on what your doctor recommends, there's short-acting, long-acting, fast-acting, super fast-acting, and that's for you to discuss with your specialist, your GP, and or diabetes educator, which ones work the best for you. Sometimes you need a combination of a couple, particularly if you're not using an insulin pump. I think I've got a picture later on, but an insulin pump is a small device, probably size of an old pager, and you can put about 2 days worth of insulin into that, and it will administer according to a logic that's put into the pump, and give you the correct dose of insulin rather than having to draw up with needles or pens each time. Continuous glucose monitoring has been a life changer, lifesaver in the last few years. This was just sort of available when Fred was first diagnosed almost 10 years ago, and they're just getting better and better every day. So this is a small device that gets, in that picture I showed earlier, gets inserted just under the skin, and it takes an interstitial blood glucose reading every 5 minutes. And that can talk to both Fred's pump and his phone, but I also get notifications on my phone, so I know if he needs assistance. It's really important to take blood glucose tests regularly, whether you've got type 1, type 2, or gestational diabetes. And the wonderful thing about a glucose monitor or CGM is that there's no more need for finger pricks. Unless someone's unwell or they need to check their ketones, it's all just taken by this device that's changed every week to 10 days, which has just been amazing. And also saves a lot of people still, if they're taking a finger prick, they'll record into like a little logbook, but this is all now, we get graphs downloaded from the pump, and from the continuous monitor that say when Fred was high, when he was low, when he was in range, how much insulin he had, how many carbohydrates he had, etc. It gives some great information when you go to your appointments. There's also a really important need for psychological support for the child or the adult, whoever has been diagnosed with type 1 diabetes, but particularly in the case of children, which is where my research has been, into support for the families of the kids with type 1. And education too. There's a lot of information when a child is first diagnosed, and it can be pretty tough at first. I found it hard, and yet I knew how to give injections. I knew how to draw up medications. I'd even vaccinated my own children out west. So I had a lot of that in my favour, but it was still a lot to learn at the beginning. Type 2 management, there are lifestyle modifications, and I won't go into these too much because I know that there's a talk by some of my wonderful colleagues in dietetics and exercise physiology. Lots of pharmacotherapy options. There's metformin, there's GLP-1 agonists. Again, that's something for you to discuss with your specialist or your GP, because there's so many different ones and there's new ones coming out all the time. Again, you need to monitor and check your blood glucose levels regularly so that you're aware of where you're sitting. Everyone reacts differently to different blood glucose levels. So, 4 to 8 is the guide of normal blood glucose levels. Some people can sit at 11 and be okay. Other people feel unwell. So it's really important for you to monitor your own diabetes and see where you're at. There's also a risk of cardiovascular illness or accident, so heart attacks and things. So just being really careful and taking the time to monitor, looking after your exercise and your diet as well. Gestational diabetes management. So as I've mentioned previously, the screening protocols or the glucose tolerance test is roughly 24 to 28 weeks. When I worked in private practice as a midwife, our women would go around that 24 weeks to go and have their blood test done. As I said, it's boring, it's not very pleasant, but it's an essential part of your health and well-being during pregnancy, particularly if you're deemed to be at higher risk. If that blood test comes back and indicates that you have got GDM, then there's nutritional counselling, meal planning with a dietitian. That's really important for you to understand the impact of carbohydrates on your diet and on your blood glucose levels. And again, making sure that you monitor those levels. I know, again, it's not pleasant. Nobody likes pricking their finger, but it's essential to maintain your health and that of your babies as well. Just from working as a midwife, a lot of women who have GDM also end up with larger sized babies. That's important to keep an eye on your levels so that you don't have a super huge one and require assistance to get the babe out. And then, of course, postpartum follow-up as well to make sure that it's been resolved. And also further on, because as I said previously, there's a higher risk of type 2 diabetes. The role of healthcare professionals is really important. So a multidisciplinary approach. So an endocrinologist is a specialist who deals with hormone disorders, and there's a couple here in Toowoomba, and there's a pediatric endocrinologist who comes up from from Brisbane to Toowoomba every month. It's important to speak to dietitians, diabetes educators, exercise physiologists, podiatrists, the impact of diabetes types 1 and 2 on your feet and on your eyes. So an optometrist is also really important to keep regular checks, and a general practitioner as well. The patient needs to be educated and be able to self-manage. That just gives you the feeling that you're in charge, which you should be. It's your body and your health. But being able to speak with all the other disciplines is really important to help as well. Again, I think I've got this in every slide, regular checkups and monitoring. And children may need to have school involvement. They may not be old enough to do a finger prick or to dose out the insulin according to their carbohydrate ratios, etc. Technology. So here you can see an insulin pump in somebody's pocket and the subcutaneous line that just goes in under the skin. So insulin pumps have been fantastic. There's new and varied ones. There's now tubeless. I think there's a couple of different tubeless ones. And they're also becoming more and more streamlined with the continuous glucose monitors, so that you can the information comes to the pump and your pump can determine that the person is going too low, for example, so it will cut out the dose of insulin so that they don't go into hypoglycemia. The wearables, I've just put that in there. I know it's sort of happening, but Apple, I'm pretty sure they've said that their next smartwatch will be able to track your blood glucose levels. But at the moment, my son does wear a Apple Watch and he can see his levels from his CGM on his watch, which is helpful, particularly when kids are at school and don't want to take their phones out or their pumps and look different to everybody else. There's apps for tracking your glucose levels and your diet as well, which are really beneficial. And telehealth, I think this is something we're doing so much better now since COVID. So it's good that something positive has come out of that whole time. But saving you having to travel to go and see a specialist or a dietitian or something, to be able to speak to them over the phone has been really handy. And they can also see, if you download your pump or your CGM information, they can see in real time what's happening as they discuss with you, which is a huge, huge change. I'm not going to discuss lifestyle modifications too much because my colleagues, Dr. Andrea Fuller and Kyle Pringle, will be talking dietary and physical activity. But I just want to mention here the importance of them, and also stress management techniques. Just anecdotally watching my son, he's just finished grade 12. He gets stressed, his levels play up. He might go high, he might go low. There's no prediction. There's no way of foretelling what's going to happen. But certainly stress plays a huge part in his life with diabetes, as it does for all of us. This is Fred when he was first diagnosed. We were living out in the Central West, and so I'd put plenty of patients onto the RFDS plane before, but never actually been on it myself. But this was the first time for me and for him. So he was diagnosed with type 1 diabetes when he was in diabetic ketoacidosis. So his levels his blood glucose level was 39.5, and we can't ever remember, but his ketones were well over 6 anyway. So he was a very unwell little boy. His body was starting to break down. He'd lost about 15 kilos in a few weeks. So that's a short term. Hypoglycemia is probably the one thing that people with type 1 diabetes mostly live in fear of, because it can come on at any time, which impacts your driving, which we've just learnt in the last year or so since Fred's got his license, and also can sometimes cause seizures, death, all sorts of awful things. So the more you can manage them, and with the new pumps and CGMs, that's certainly helping to knock out a lot of hypos in our household anyway. Long-term complications can include cardiovascular disease, neuropathy, retinopathy. There's other things, but I try not to talk all the doom and gloom, because I like to think of diabetes as being something we can manage. But if you do look after yourself, there's less risk of having these happen. So again, important to have regular screenings and checking your blood glucose levels on a regular basis. Conclusion, this is Fredo now, or a few months ago, I think. Personalised care. Every person with diabetes is different, and every case is different. Honestly, every day seems to be different. We think we've finally got something down pat, and then there'll be something else will happen. So we're never entirely sure what's going to happen to it. I really believe, and I know JDRF and Diabetes Australia state that language matters. Rather than calling Fred a diabetic, I prefer to say that Fred has diabetes or has type 1 diabetes, because his illness doesn't define who he is. Proactive management, being able to take care of things before it happens, is much easier than trying to do it after and following. You're trying to play catch up, and again, a multidisciplinary team. Again, I could talk for hours, but I've been given a limited time. So hopefully this is some information for you. These are the resources or the references that I used. So if you want to take a screenshot, yeah, you're more than welcome. These are all the websites that are helpful for some further information about diabetes of all types. Anyway, I hope this has been helpful, and thank you for listening.